On behalf of our center and our partners, the World Economic Forum and the Bill and Melinda Gates Foundation, I'd like to extend a very warm welcome to our audience here in New York, as well as our larger virtual audience participating online today. The Event 201 scenario is fictional. Today's scenario is going to simulate meetings of a multi-stakeholder group called the Pandemic Emergency Board.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
There's been some conspiracy theories that are around about the potential that pharmaceutical companies or the UN have released this for their own benefit.
And maybe this is a time for us to showcase some cases where we are able to bring forward some bad actors and leave it before the courts to decide whether they have actually spread some fake news.
A new coronavirus. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia.
In related news, a significant demand for personal protective equipment like N95 masks and gloves are on the rise. Patients are overwhelming healthcare facilities. People are avoiding public spaces out of fear of infection and in compliance with public health recommendations. Our U.S. affiliate has just released polling results on public expectations for a vaccine, and 65% of those polled are eager to take the vaccine, even if it's experimental.
I'm not optimistic about having the vaccine in time to be relevant during this pandemic.
With enough money and political will, anything is possible.
Penalties have been put in place for spreading harmful falsehoods, including arrests.
If the solution means controlling and reducing access to information, I think it's the right choice.
What exactly are the risks and benefits of staying home from work? Absolutely, we need to save lives, but we literally cannot afford a heavy-handed response that suffocates our economy.
The world saw large-scale protests and in some places riots. This led to violent crackdowns in some countries and even martial law. The public lost trust in their respective administration. Economists say the economic turmoil caused by such a pandemic will last for years. The societal impacts, the loss of faith in government, the distrust of news, and the breakdown of social cohesion could last even longer.
Officials in 2 Latin American countries alerted the WHO of several outbreaks of a new infectious disease that's mysteriously appearing across the region. Severe Epidemic Enterovirus Respiratory Syndrome 2025. Over the past 6 weeks alone, there have been 500 confirmed or suspected cases reported. The virus could cause a severe pandemic if early containment and mitigation efforts are not successful.
The pandemic in this type of situation and trend would be a risk for the global health security.
Pandemics are inherently political, financial, and so much broader.
We have not spoken on the leadership in country. And I think that we need to be also very careful. We cannot decide a lot of things without the leaders be involved and agree on that.
There is no substitute for national leadership.
It's important to support the local response or the national response.
Training those that are in these areas first, enabling them with the tools, protecting them, and if needs be, regional solidarity first.
At this stage, communication is key, and communication should include not just scientists with data, but also social, religious, and political leaders.
Trust. This is an essential issue, and trust was broken among countries, between populations and healthcare systems, between healthcare systems and governments.
I'm very sorry to say that in 2025, we need to strengthen the health system.
WHO needs to be a voice for the voiceless.
No one is safe until all of us are safe.
As of today, there have been an estimated 1 billion cases worldwide, with more than 20 million deaths, including nearly 15 million children. Countless millions are alive but left with paralysis or brain damage. The most successful countries are those which invested in preparedness and trained for this moment years in advance. This included having full-time pandemic preparedness and response teams, which conducted detailed operational planning and routinely tested those plans through exercises and drills. If more countries had participated and heeded the guidance, the toll might have been much less.